everyone, I'm Mike Ward and welcome to Conversations in Healthcare, a video series brought to you by DRG, part of Clarivate. This episode is one of a number that we're recording alongside On Helix, a digital conference that is hosted by One Nucleus. In line with this, I'm delighted to be joined by Russ Bradford and Charlotte Allen from Parkinsons Concierge, an organisation established and run by patients to raise awareness about how best to help people with Parkinson's disease. With many companies in the life sciences sector having a stated mission of being patient-centric, this conversation will let us hear firsthand the views of those closest to the disease. So Charlotte, Russ, thanks very much for joining us, and I hope you and those you care about are all keeping well.
Thank you.
Thank you.
Thanks very much for inviting us. We're delighted to come and tell you a bit more about what we do.
Great. So what sort of prompted you to co-found the organisation in the first place? I mean, can you outline what Parkinsons Concierge actually does?
Yeah, essentially what we are is we are a voice for people with Parkinson's. We both have Parkinson's, we're partners to each other, so we're both carers for each other too. So we're quite an unusual sort of business model, quite unique. We wanted to set up Parkinsons Concierge to help all the people access things that they weren't aware about, campaign for better sort of entitlements for people with Parkinson's. Everybody always believes people with Parkinson's are elderly people, but they're not. There's children ranging from 9 to 10, right up the scale of ages. So we established Parkinson's Concierge to work with the charities, but do a totally different job. We're not a charity, we are a limited company, and we spend every day of the week campaigning or researching or looking into sort of services and products that people can offer to people with Parkinson's, mainly to improve their quality of life.
So who are you most looking to influence as Parkinson's Concierge? Is it people with Parkinson's, or is it other people who might not be as aware of the challenges?
A bit of both, Mike, to be honest. There's a number of Parkinson's support groups that can be found on the likes of Facebook or social media. Where we differ is Charlotte and I both come from a business background. So we've noticed for a long time within the community, there's a lot of awareness creating, but that tends to only be delivered to the people with the condition. Where Charlotte and I want to make radical change is we want to campaign, educate, and create awareness to people outside of the community who know very little about the community, such as, the commercial side, the big towers in London. We want to go in and tell people what it's like living with Parkinson's, because as the world's fastest growing neurological condition, there's still a lot of people don't know anything about Parkinson's.
So what are the sort of the key challenges? I mean, you sort of say that there's sort of maybe not so much awareness, but specifically, are there sort of particular sort of issues around the condition that you think that people should be more aware of?
Totally. Now, I don't know whether people are aware, but Parkinson's disease actually affects everybody differently. There's very rarely two people the same, which obviously makes it harder for the academics and the people in research, because we're all so different and everyone suffers with different symptoms. It's going to be hard to find a cure, and really we believe in our lifetime there probably won't be a cure, and therefore we've chosen to concentrate on quality of life, the here and now, so everybody can live their life. The other thing we're very passionate about, because we are all different, is patient-centered healthcare. We promote this wherever we go, because we're all different. Again, we should have a tailored care package to match the individual because giving everybody the same drug would not have the same effect. So really, we're shouting out to the academics, the professionals, why not get to know us, engage with us. We'll talk to pharma, we'll talk to anyone who'll listen to us and that can help our quality of life and improve our sort of like daily lives, and also the lives of people that we live around, our families and friends and everyone.
Okay, so we'll come back to that patient centricity, but before that, I mean, are there some sort of examples of work that you've already done, successes that you've actually had with Parkinson's Concierge?
Yeah. Thanks for bringing that point, Mike. Charlotte and I have recently received an award from the European Society for Patient-Centered Healthcare, the ESPCH, for our advocating work within and also without the community, for the work that we've done.
We've also had a film made of our life story, which is a 25-minute short film, which is currently going around the film festivals. It was due to go to Cannes even, but it will be going around the film festivals. But we've had that sort of produced by professional actors, and it's all about our life story and what we've experienced along the way too.
So there are those things, but I just wondered, sort of example, you sort of said about how you're helping people,
Okay.
sort of deal with Parkinson's, etc.
Okay.
I just sort of, are there sort of some key tips that you guys have developed, or?
Yeah, Mike, we've actually developed quite a following. With the onset of Parkinson's, a lot of people go into a zone and they do one of two things. They either join a group or they steer away from the group, and they also tend to lock themselves away from people. And, quite often that involves being non-disclosive about the condition to family and friends, or they become, well, like hermits, because it can affect you with a lot of specific ways. It can cause a lot of types of disorders, a lot of tendencies like suicidal thoughts, mental health. And what we try to do is we reach out to people who I feel are going through a similar journey that I once went through. And, we now kind of know the signs to look out for and where we're best able to deliver our services.
Yeah, and also recently we've teamed up with Parkinson's UK and the Excellence Network, and we're doing a webinar once a month and bringing the community together with the experts that are research or specialist nurses or whatever, and getting them to do a Q&A session with the community and really get any questions they're not sure about answered. And this is something that hasn't been encouraged before or hasn't been done before. Also, we're building a global Parkinson's community alongside a sort of new organisation we've met called ReMeLife. And they've actually set up a page for Parkinson's, and literally we're building a community right across the globe and trying to attract as many of those 10 million people with Parkinson's. Obviously we won't attract them all, but we're looking for them to join our community, and we're going to have an online health and wellbeing portal that anyone can carry out anything to improve their lives virtually.
Right, so you have these webinars where you're engaging with experts, and it means that people with Parkinson's or their carers can watch this and some tips, etc.
Mm-hmm.
And you mentioned the fact that earlier on about sort of academic research, etc.
Yeah.
What sort of engagement have you had with either your research groups or even sort of even pharmaceutical companies, and around sort of clinical trials of treatments?
Well, I've been involved in a lot of research studies for not only my neurologist, but for Charlotte's neurologist, based up in Newcastle. We're very, very privileged to have a fantastic team. We've got probably one of the best networks for Parkinson's in the country, I would say. We've got facilities in North Shields, South Shields, Durham, Sunderland, Darlington, Newcastle, and I quite often get involved with research at the Carew Centre in Newcastle, in the Cresta Clinic. That involves, I was on one research operation where I was trialing a drug for 6 months. I've been on an extended MRI scan, and I wanted to physically take photographs of my journey, because a lot of people tend to be scared of MRI machines or the whole process. And my involvement is, to say to people, this type of research is very valuable to whoever's carrying out the research, but it's also nothing to be scared of. I'm trying to encourage people, that if I can do it, you can do it.
Also, we sit on various committees, don't we?
We do indeed, yeah.
We sit on a lot of research committees, a lot of teaching hospital committees. We're heavily involved with the Parkinson's nurse study that's going on at the moment. We are looked upon as patient experts, aren't we?
Yeah.
But, most weeks, before COVID, we were 2 or 3 times a week, maybe in some of the hospitals, helping out on research.
And likewise, travelling up and down the country to London was quite our thing, to take part in conferences, to enlist in research in other areas, and also meet and greet other sufferers of Parkinson's.
We've even got people who mentor us from the States that have heard about us from sort of biotech companies or whatever companies. If anyone's involved with Parkinson's and wants us to help out, we will, gladly help. So it's not just in the UK we've been helping, it's in Belgium and all sorts of places, isn't it?
Okay, so you mentioned that you're not a charity. So how is Parkinson's Concierge funded?
A very interesting question with a very interesting answer. At the moment, it's funded out of our own pocket. We don't take donations, we gladly take donations to keep running. And in the past, every penny we've taken as a donation has been handed over to charity. We're involved with the UK charities, helping them, or certainly coming up with ideas for fundraising events. Unfortunately, with COVID, the outdoor element of fundraising events, which basically fund charities, has come to a rather abrupt stop. So, we try and encourage funding for charities as such. But with regard to our own funding, it's been proven quite difficult to get the right kind of organizations to basically sponsor what we do. We're always looking for grants, etc., for educational videos that we've produced. I mean, last year I had DBS. I'm not sure if you can see the scars there. And because a lot of the online videos available for people receiving DBS were quite Americanized in their talk, in their tone. There was very little available for the UK market, where things are done differently. And so Charlotte and I applied for a grant funding for that educational video, which was received and turned into some, I think it was a set of 3 videos. But other than that,
well, it was initially funded, wasn't it, by, I have two companies, so we own this company, and then I have a recruitment company, which I also work in full time. So obviously recruitment now is not, well, there's no business, but initially that my proceeds from that went into this company to start it up, and that's how we managed to start up at the beginning, wasn't it? But essentially everything else has been self-funded. It's really, really tough because we live in Newcastle and all the conferences, as you know, are down in London. And we do go to quite a few, but it's all self-funded, so it all adds up. So if anybody's got the belief in us and wants to help us out, we'd never turn any money down.
I mean, part of that, sorry Mike, part of that funding also included a trip last year to the World Parkinsons Congress, which was held in Kyoto in Japan. So that was that was an expensive trip.
So apart from the sort of, sort of the financial sort of challenge, what are the other sort of challenges that the organisation faces? I mean,
challenge-wise, how busy we are at the moment and how fast it could expand, and being able to cope with the volumes of business we're experiencing at the moment. We've recently had two great people join our team, Helen and Richard Underwood. Richard's also got Parkinson's and Helen is his wife, but they're an instrumental part of our expansion and how we're growing bigger. And, bearing in mind we've teamed up with ReMeLife and now it's going global. We've got people from all over, everywhere, asking us to do webinars for them because we're hosting webinars for people. But we're doing like all-inclusive webinars where we actually do all the preparation, and whoever the company say, oh, we'd like to have an audience of Parkinson's people, so we get them together. Or they might say we want a panel of physiotherapists, so we'll get them together. We can put the two parties together from both communities so they can reach the audience they're targeting at quite easily, and then literally have a sort of pre-webinar meeting, and then off they go. It's all arranged for them, and we've got the contacts that we built over the years now.
So, as I mentioned in the introduction, a lot of companies, they state that they're patient-centric, and you guys, must be, have a lot of first-hand experience of exactly how patient-centric they are. I just wondered, what would you like sort of companies to do to improve the lives of people with Parkinson's?
Personally, I would like inclusion, not exclusion. And by that, I mean anyone who's working for Parkinson's, please, never make a decision about us without us. We have a lot of experience. We can put you in touch with a lot of people. And because Parkinson's is so variable from person to person, what's right academically for somebody coming into Parkinson's without knowing a person with Parkinson's, the academic side or the aspect of academia may not be appropriate for that one person. So I would very much like to see any companies or any pharma or med tech, please include us.
I think as well, it's been so long that everybody's been researching for a cure. And I personally think if you get to know a community of people with Parkinson's and actually can relate to them, talk to them about their past, what they've grown up with, where they've lived, what other sort of conditions they suffer with, I truly believe that will open up more ideas into what they're treating and what the cause of it is.
Right. Good. Well, I wish you absolutely, well with all the sort of the efforts that you guys are putting forward. Thanks very much, Charlotte and Russ, for taking the time to talk to us. I think the insights that you shared there, sort of the challenges faced by people with Parkinson's, and are going to be of great interest, particularly, as I say, that, companies who want to be patient-centric. I think that you've kind of shown them a way that, how they can actually achieve that. So thanks very much for joining us. Thanks to all our listeners for tuning in. If you'd like to actually tune into future episodes, follow us on our LinkedIn page, because we'll be posting alerts to future episodes. So until next time, stay safe and healthy. I'm Mike Ward, and I'll see you in the next episode.